Okay, so good morning, students. Let me check. Is it working? I think it is working. Okay, so today, as I said yesterday, students, today also we'll be taking the discussion forward on MCQ based discussion on National Health Program. And if you remember, yesterday also we took 10 to 15 questions. So today also we'll be taking certain questions so that it helps us to understand the programs. Okay. A very good morning to Prachi, Jelina, and others, those who have joined. Okay, let's start. So, as always, Unacademy is the largest learning platform which help us to, crack PG. Uh, Here we have daily live classes, tests, live tests, quiz. There are a number of structured courses going on. You have unlimited access to all the courses and the content. You have different educators from different parts of India coming and teaching. Lots of courses are going on: foundation course, revision batch course, concise course, and this is the way you can get the subscriptions. There are different ways, different based on number of months. So it is you have an interactive live classes. So I do think it is a nice platform to join and understand the subjects, different subjects taught by different educators. And if you want to join, you can use my code also. That gives you 10% off. No, the code is given on the slide, the bottom of the slide. Okay. So this was just a small this about what we are doing. Now coming to the questions, students, today's discussion. Uh, if you see, the first question is Village Health Nutrition Day. You must have heard this. Village Health and Nutrition Day is observed every week, every month, every 6 months, every year. So can you answer this question, students? Yeah, good morning to all of you. So can you answer this? Village Health Nutrition Day is observed every week, every month. Ravi Bhushan is saying every month. Okay. Anyone else who wants to try? Village Health Nutrition Day is observed every week. Sonam, Narsimha Reddy every 6 months. Okay, so we have B and C options. Okay, but majority of the students are saying B. Yes. So whenever we talk about this Village Health Nutrition Day, which is also called VHND, and sometime nowadays they are calling it VHSND now. Village Health Sanitation and Nutrition Day. Okay. So as you know, students, and just to make it more clear, the answer is every month. And the thing what I want to emphasize here, students, in a week, every week, what happens? There is a routine immunization session, RI session. Okay. So this basically primarily focuses on routine immunization. Now the plan is that on a day you should have routine immunization can go, no problem with this, but you should also focus beyond routine immunization. When I say beyond routine immunization, let's take other components of health also. It's not only RI, routine immunization, it should have other components of health, other component of nutrition, and other component of sanitation. So the prima facie, the focus is not only on immunization but on other component also. So this was the monthly Village Health Nutrition Day guideline issued by Government of India. This is just a snapshot of that document. And if you see what is how it is done, once every month this VHND is organized. Normally it is organized on Wednesday, and if there are villages which have been left out and we were not able to organize them VHND on that Wednesday, you can also organize that VHSND or VHND, what we call, on some other day in the same month. Preferably we use the platform of Anganwadi Center, where it is easy because Anganwadi centers, Anganwadi workers are there, Asha can come, ANM can come, so they can work together. Now, the role of Asha and Anganwadi is to mobilize the villages. Now, in villages, primarily they call women and children so that they can come and they can interact. They can interact freely with the health personnel so that they can obtain the services provided by the government of India. They can also learn some preventive and promotive aspects. And this VHND is organized very close to the habitation. When I say very close to the habitation, means very near to the village, where the villages do not have to travel a lot. So the purpose of VHSND, you say, or VHND you say, is to focus on nutrition component, focus on health component and sanitation component also. So this day which is observed, it acts as a platform where all the informations are given to the villages. Okay. So this is about VHND. Now let's take the next question. Easy one. 90s to 90s to 90 target in National Health Policy 2017 stands for. Now answer this, students. Is it 90% of all people living with HIV know their status? 90% of people diagnosed with HIV infection receive ART. 90% of all people diagnosed with HIV inflammation and TB know their status. 90% of people diagnosed with HIV infection TB receive sustained ART and ATT. 90% of all people receive antiviral therapy will have effective viral suppression. So just try, students, what will be the answer to this. So Sonam is going with B. Okay. Anyone else who wants to try? Deepu. Yes, Deepu. Where is Deepu? Deepu is answering A, B, and E. Yes, you have to think in that way, because what is the question? Question is 90, 90, 90. Now 90, 90, 90 cannot be only, there cannot be only one answer. So you have to think there can be three answers. No, 90% of people living with HIV know their status. 90% of people diagnosed with HIV. So out of these five options, so you have to select three, because the question is like that. So it cannot be only one answer. A, B, E. A, B, E. Yes. Now let's try to understand this 90, 90, 90 concept. Absolutely right, those who have answered, Deepu, Sonam, and others also. A, B, E. Now, what is the question saying? 90, 90, 90. Let's write here 90, 90, 90. Now, options, if you see, because this is not this 90, 90, 90, you will not only find in HIV, you can also find this in TB also. So, but let's not talk about any disease. Let's try to understand this 90, 90, 90. So, whatever target if you keep, whatever target you have kept, students, now it has been a policy, or it has been a trend that the targets which are framed is kept in such a way that people remember, no? Health officials, people remember, and it becomes catchy. Now, if I say 90, 90, 90, so what does this mean? It means that with regard to this national health policy, it means that 90% of the people should know their HIV status. Okay, suppose there are 100 people. So out of that 100 people, 90% should know their HIV status. Out of that 90 people who know their HIV status, so 90 people is knowing HIV status, so 90% of 90 should be on ART treatment. Okay, so this is the second one. 90% of people diagnosed with HIV infected receive ART. So 100 people, total 100 people were there. Out of that, 90 people should know their HIV status. 90% of 90, what happens? How much it is? Just see. 90% of 90, no. So it goes, it's 81. So 81 people should be on ART treatment. Now out of that 81, 90% of people who are receiving ART should have viral suppression. Means they should be responding. So 90% of 81 should have effective viral suppression. So don't get into this that what is this 19 19 19. It's very easy. It has been just framed in such a way that we can think it becomes easy. The target is very near to 100, so let's keep it at 90 90 90. But if you understand in this way, then you remember for long term. 100 people, 90 should be knowing their status. Out of that, 81 should be having ART treatment. Out of that, 90% of 81 should be having successful treatment, which viral suppression should be there. So this is 90 is to 90 is to 90. This is also there in TB also. This can be also used in other places also, students. So don't get into trap. This is something very much specific to HIV. It is not very specific to HIV. This is just a way to explain, way to express the target. Okay. Now, let's take the next one. Hayden Matrix is related to, is it related to hypertensive disorder? Is it related to communicable disease? Is it related to maternal and child mortality? Is it related to injury prevention? Just try this. Hayden Matrix is related to hypertensive disorder, communicable disease, maternal and child mortality, injury prevention. Anyone? Sonam D. Where is D? Yeah, D. Ravi Bhushan D. Okay. So if you see Hayden Matrix, Nandini also D, Jelena D. Okay. Yeah. So Hayden Matrix is not related to hypertensive disorder. It is not related to communicable disease. It is not related to MCH, maternal and child mortality. It is related to injury prevention, students. Absolutely correct. Now, this is a theoretical approach to injury prevention, and this was developed by Dr. William Hedens in 1970. So basically, prevention, the principles of injury prevention is based on this matrix. So they talk on 4 components. They talk on reduce exposure to risk, prevent road traffic crashes, to reduce the severity of injury in the event of crash, to reduce the consequences of injury through improved post-collision care. Now let's try to understand this, what actually it means. Now if you see, there are 3 phases to it: pre-injury, injury, post-injury. Okay. Now when we take pre-injury, what can be the human factors? So the human factors can be alcohol intoxication. What can be the vehicle factor? Instability in utility vehicles. What can be the physical environment? Poor visibility of road hazards. Socio-economic environment, lack of knowledge regarding injury risk. So if you see in pre-injury phase, the human factor, there can be a person can be intoxicated, the vehicle is not in a good condition, the road is not visible, and there is lack of knowledge regarding injury risk. Now when we talk about injury, during the phase of injury, there is less resistance to energy, sharp and pointed edges as far as vehicle is concerned, flammable building material very nearby, and we are not following the rules and safety rules, safety belt legislation. Post-injury, what can happen? There is condition affecting energy tolerance, how much tolerance capacity we have, rapidity of energy reduction, vehicular fog, emergency medical response services are there or not, and this can be attributed to lack of funding. So what Hayden Matrix is trying to map it out. They are trying to map it out the human factors, the vehicle factor, the physical environment, and socio-economic environment. All, if you see all components, then only you will be able to prevent injuries due to vehicular accidents and all. So this was the way Hayden Matrix mapped different components. Now let's take the next one. Steps. Steps done for is the steps done for surveillance of risk factor of non-communicable disease, surveillance of incidence of non-communicable disease, surveillance of evaluation of treatment of non-communicable disease, surveillance of mortality from non-communicable disease. So try this, students. What is the step approach? What could be the answer? Steps done for surveillance of risk factors of non-communicable disease, surveillance of incidence of non-communicable disease, surveillance of evaluation of treatment of non-communicable disease, surveillance of mortality from non-communicable disease. So Ravi is going with C. Okay, Nandini is also going with C. Okay, anyone else? Anamika, C. Okay, now students, what you do, this step approach, it is talking about surveillance. Now, when it talks about surveillance, so surveillance, and it talks about NCD. First of all, step approach is for non-communicable disease. Now, when you talk about non-communicable disease, steps is basically surveillance of risk factors of non-communicable disease. It doesn't talk about in disease. This is not for the disease, this is not for the treatment, this is not for the mortality. And Jelena is absolutely right. This is surveillance of risk factor for non-communicable disease. You are trying to do a surveillance on risk factors which can lead to non-communicable disease. Now, see, there are basically steps approach is a WHO approach. It is of two types: chronic disease risk factor surveillance, stroke surveillance. So it is done for chronic disease NCDs risk factor surveillance, and in that also it is also used in stroke surveillance. Now how it is carried, students? Just try to understand. There are 3 steps, and start thinking in the way. Suppose what can be the first step? If you are approaching step surveillance, the first approach is in NCD. You are trying to map the risk factors. So the first thing is you will try to see the behavioral component. Now, what is the behavioral component? What is the pattern of tobacco use? What is the pattern of alcohol use? What is the pattern of diet use? What is the physical activity pattern? Is there any history of blood pressure? Is there a history of diabetes? So you are trying to map the behavioral component. Once you are done with the behavioral component, the second component will be physical measurement. So once you know the behavior, then you try to measure physically. So you are try to see the weight, height, waist circumference, blood pressure, hip circumference, whatever. So once you're done with the physical measurement, then you can do the biochemical measurement. No? You can take the blood glucose, blood lipid, you can also go to triglyceride, HDL cholesterol. So step approach starts from the behavioral component, then it goes to the physical component, and it goes to the biochemical measurement. So this is the way the approach is, and it is logical also. A person comes, you suspect that this person may be a NCD candidate, so let's try to you screen it. So what component? The first thing you not go directly to measure its weight and height or biochemical measurements. First thing you will ask, you will take history, whether tobacco use is there, alcohol consumption is there, diet use, what is the pattern of diet, what is the physical activity. So once you find something here, then you can move to physical measurement and then the biochemical measurement. The steps approach gives you a pattern how to do surveillance in NCDs to identify the risk factors. Now, this is the easiest one, students. According to IMNCI, fast breathing in 5-month child is defined as. According to IMNCI, fast breathing in 5-month child is defined as. When do you say that what should be the respiratory rate in 5-month-old child to say it is a fast breathing? Anyone? Is it 30, greater than 30 per minute? It is 40 per minute, greater than 50 per minute, 60 per minute. Try this. Prachi is going with B. Sonam C. Nandini also C. Others also, everyone. Anamika C. Sweetie C. Navratri Mishra 50. Yes. Now, first of all, students, how you can comprehend this? IMNCI, first you should know what is IMNCI. IMNCI is integrated. I stands for integrated, M stands for management, N stands for neonatal, C stands for childhood, I stands for illness. So it is integrated management of neonatal and childhood illness. So this is a program which talks about which take care of 0 to 5 years age group children. Now, what the question is, fast breathing. When do you say fast breathing? So this caters the age group of 0 to 5 years. Okay, from birth till 5 years. Now, let's divide into 3 group students. First is 0 to 2 months. Second is 2 months to 1 year. And third is 1 year to 5 years. Okay. So what I did, this program caters birth till 5 years. So what I did, I divided this birth till 5 years into 3 age group. 0 to 2 months, 2 months to 1 year and 1 year to 5 years. If the child is in the age group of 0 to 2 months, so greater than 60 per minute. Okay, greater than equal to 60 per minute if is your respiratory rate, then you call it as fast breathing. Okay, greater than equal to 60. If the child is in between 2 months to 1 year, so it becomes what you all people have answered correctly. It should be greater than equal to 50. So in this question, the child is 5-month-old child. So it should be greater than equal to 50. So the option says greater than 50. So it will go by 50. Now 1 year to 5 year, if the child falls in between 1 year to 5 year, it happens to be greater than 40. Greater than equal to 40. So to remember easily, 60, 50, 40. 60 is less than 0 to 2 months, 2 months to 1 year, and 1 year to 5 year students. So this is the way to remember, and it becomes easy. And this is the program which caters 0 to 5 years. So the answer is greater than 50. Now let's take the next one. India's HIV/AIDS Prevention and Control Act was passed by Indian Parliament in 2016, 14, 17, 18. So this, we have an act now on India's HIV/AIDS Prevention and Control Act, and this was passed by Indian Parliament in 16, 14, 17 and 18. Just try. Okay. Navratna Mishra is 2014. Anyone else who wants to try? Sonam is going with 2017. Anamika going with B. Okay. Now, the answer to this question is 2017. Now, what is this act, students? The act is the HIV and AIDS. No, this act basically talks about to address this discrimination component. Okay, when I say discrimination, as you know, there is every possibility of discrimination when a person suffers from HIV positive. So we have an act now, HIV and AIDS Act 2017. It says that means the discrimination against HIV positive person and those living with them is prohibited. You cannot do discrimination. Where you cannot do discrimination, you cannot discriminate in employment. You cannot discriminate as far as educational establishment is concerned. You cannot discriminate in healthcare services. You cannot discriminate in renting, residing properties, public and private offices, and insurance means thing. So these are the 6 points where you cannot discriminate. You cannot discriminate on job, education, health services, properties, office standing for public or private office, and insurance. So basically this act tries to prevent the discrimination, and this gives opportunity to all those HIV positive people to survive, because we have now ART treatment going on. This helps a lot. So why to discriminate? No, if the precautions and if ART treatment is going on, so on this 6 component you cannot discriminate. So this is the act basically on that. Okay, now let's take the next one. How many health conditions identified for screening under RBSK program? How many health conditions identified for screening under RBSK program? How many health conditions, means disease conditions, different health conditions, is screened under RBSK? Is it 30? It is 28, 34, 36. Now Vrata Mishra is saying 30. Yeah, Nandini is also saying 30, I think. Yes. Anyone else who wants to try? Okay. 34. Somebody is saying 34. No. Sonam is saying 34. Somebody is saying Sweetie is saying D. 36. Now, under RBSK program, first of all, you should know, students, what is RBSK. RBSK is Rashtriya Bal Swasthya Karyakram. Okay, so it's a Rashtriya Bal Swasthya Karyakram. Now, this is the program. So it is very much related to Bal means children. Now, here what they are trying to do under this program, RBSK. So the answer is 30. It's not 28, 34 or 36. So just try to understand this, students. The NHM, initially it was called NRHM. It was NRHM. Now you have NUHM also, so it becomes NHM. So this Rashtriya Bal Swasthya Karyakram is basically a child health screening. You try to screen an early intervention service program. You are trying, once the child is screened, so you will be providing services. Now it talks on 4 Ds. 4D. What is that 4D? Fourth is defect, birth defect, that is defect, disease, deficiency, and developmental delay and disability. Okay, so it talks on 4D: birth defects, deficiency, disease, and development delay or disability. So this is 4D. So Rashtriya Bal Swasthya Karyakram acts on, focuses on 4D. Now, which age group of children they are catering? The Rashtriya Bal Swasthya Karyakram is focusing from birth till 6 weeks. Okay, so either taking at baby born at public health facilities or home, wherever, birth to 6 weeks. From 6 weeks to 6 years of rural and urban slums, and from 6 to 18 years also, students from 1st to 12th government or government aided school. So it means, in simple terms, from birth till 18 years, either taking birth at home or public places, hospitals, or in urban and rural slums, and lastly all those studying in a government school or government aided school. So what they are trying to do, they are trying to focus on 4 Ds, as I said. The first is defect. So in defect at birth, so these 9 diseases they are catering under this defect at birth. neural tube defect, Down syndrome, cleft lip palate, Taleb's clubfoot, dysplasia of the eye, congenital cataract, deafness, heart disease, retinopathy of prematurity. So this is the defect at birth. Now if you see deficiency, they have 5 things they have entered into deficiencies. Childhood disease they have taken 6, and the rest 9 is they have taken into delays and disabilities. And last one, 30th, they have added as congenital hypothyroidism, sickle cell anemia, and beta thalassemia optional. So if you see this picture, this diseases, so it happens to be 30 diseases. So 30 diseases are screened in RBSK program. Okay, 34. I think why people have answered 34 was 34 diseases are mentioned in ESI Act. If you remember, 34 diseases where extended sickness benefits are provided is in ESI. But in RBSK it is 30 students. Okay, now let's take the last question. Sathya is being hired under which program? Sathya, this Sathya component is being hired under which program? RKSK, RBSK, VHSND, UHSND. Just try this. Sathya is being hired under which program? RKSK, RBSK, VHSND, UHSND. Oh, Venugopal goes with A. Very good. Anyone else? Prachi with A. PG is with B. Okay, so we have 2 answers, A and B. Now, Sathya is not under RBSK. It's not under VHSND, it's not under UHSND, it is under RKSK. Now, what is RKSK? RKSK, Rashtriya Kishore Swasthya Karyakram. Kishore, whenever the word is used, you can link this with adolescent. Okay? So, Rashtriya Kishore Swasthya Karyakram, RKSK strategy. Now, Sathya is a component of RKSK, very rightly said by others. Now, what happened what is expected of Sathya? So, there is a peer education program, okay? We select certain peer educators and we name it as Sathya. So, what we do, we select 2 educators, 2 peer educators, 1 boy and 1 girl. Okay, and this will selected per 1000 population, means for every 1000 population we have 1 boy and 1 girl. So both have been named as Sathya. Okay, now what they will do, 1 boy will make a group, peer educator group, the girl will make girls group, and every week, weekly they will have 2-hour discussion. Okay, so they will have a 2-hour discussion on different components, and on 50 rupees incentive is also proposed. 50 rupees, not percentage, 50 rupees is been proposed for Sathya. So basically it tries to cater the adolescent age group so that the correct information about the different phases of life, education, sex education, and different components of things are not discussed. And what happened here? Okay, so this Sathya means those who have been hired, they are also helped by A&M also, no, because A&Ms are there, so they are more, they know more, much more than that, much more. They have got much more information. So what they do, they also helps the Sathya. So basically, this is trying to create awareness in adolescent age group with the help of them only, with the help of community participation. So out of total adolescent groups, means male or female, we select 1 boy, 1 girl. So boy forms a boy group, girls form a girl group, and they try to discuss, try to talk about different components of health and whether everyone is aware or not. So if this strategy is implemented or executed to perfection, it definitely helps in raising the awareness. Yeah, normally the platform which is used, they can use the platform of Anganwadi's work center. They can also use the platform of health sub center. The platform, I'm talking about the platform, they can use. If they don't have, they can get in touch with Asha. They can get in touch with the Asha, and then they can have a discussion where they want to have the discussion. No, so we have an Anganwadi center in every 1,000 village. So they can use that platform. They can use also his health sub center if there is a possible. They can use that, and if not, they can get in touch with Asha. The Asha will guide them, because see, in village what happened, you have VHSNC committee also, no. So these committees, the Asha, ANMs and other members are also are participating in this. Now if you don't have a good place of Anganwadi center, the place is not available, it's very far, and the Asha along with the peer educator decide in close consultation of VHSNC to conduct at any panchayat bhavan or any schools buildings, primary school building. So they have to decide. It's not any fixed place. They have not given any fixed place that you have to do here only. You cannot do there only. So that much flexibility is there. So it helps basically to raise awareness. Okay. So I'll stop here. So these are the few questions. There are many questions. Programs keeps on evolving, keeps on coming. You have program now. We have different guidelines for COVID-19 also. So the best way of understanding program is always we should be in touch with the National Health Mission website, because they come up with different programs, the Government of India program. So whatever any changes, if it happens, we can be well informed. And the new components also, like you have Sathya, you have Suman program, you have SANS program. So there are many programs which comes on. So you will be aware. So I advocate students. So NHM National Health Mission website, if you go, Ministry of Health and Family Welfare website, if you go. So any recent changes or any programs, anything which happens, so you will be updated with that. Okay. So with that note, students, thank you for joining. So I'm also taking a special class today in the evening, 10 o'clock in the night, on recent initiatives on COVID-19 by Government of India. So if you have time, you can join there on Unacademy platform, special class, recent initiatives taken by Government of India to fight COVID-19. Okay, thank you.